Welcome to 5 Ways Families Can Deal with Racism in Healthcare and Education. I'm Nikki Montgomery, and I'm the Family Education Research Analyst for Connecting for Kids. This program is presented in partnership with Mother to Mother. The first part of this session will be a short discussion about racism in schools and healthcare settings. And the second part is about dealing with the issues that come up and really working around the racism that we know exists in these systems. We know how frustrating it can be to deal with racism in healthcare and education, but we don't always know a solution that gets the best results for our kids. First, it's important to know that not all professionals are experts at all parts of their jobs. The professionals we deal with may not have experience overcoming their own implicit bias, and they may not have cultural competence. They may be building those skills, but in the meantime, we need to be prepared to work around the biases that they might have to get better results. Research has shown that professionals have implicit biases. We all do, and we don't always realize we're feeling them. These implicit biases can affect the way you and your child are treated, and they can even affect whether and how a professional will help you and your family. Schools and healthcare systems realize this is a problem, and a lot of them are offering training so that their employees can work on their own biases. In the meantime, we as families have to know that there are certain types of biases we might deal with. For one, we might deal with microaggressions, outright discrimination, even disregard of our opinions and input, and assumptions and stereotypes. Those are just some of the types of racism that we deal with. And sometimes, because a professional we're working with hasn't really developed the skill of dealing with their own implicit biases, that may affect the way they interact with us. And we have to deal with those consequences. The hard part is we can't tell who we're dealing with at first. So you can't immediately tell whether a person has these beliefs and is acting on them or whether a person doesn't. We really hope we're dealing with professionals who are not acting on their bias, but we don't know. So we often have to go in blind and figure out whether and how we can work with a professional. Our goal is to recognize that because we don't always know where people fall on that spectrum of understanding, we have to be prepared to get the best out of them regardless to help our children. We have to learn to navigate the system and also navigate the people in the system to get the best outcomes for our children. So let's talk a little bit about how to work around these challenges. The 5 tips that I'm offering start with number 1, which is nurture your relationships. When we think about the things that make a relationship of any kind work, we think about trust, communication, reliability. All of those things still apply to the relationships we're forming in healthcare and education on behalf of our children. So we should treat these interactions with professionals like a healthy relationship and less like a transaction where I give you something, you give me something, but really learning each other and creating personal connections that help them to know us and remember us. We want to introduce who our child is, and not just who your child is in a diagnostic sense, but who your child is at home and how your family sees your child. So you create that personal connection. Another way to nurture your relationships with professionals is to really talk about your goals. Talk about what you see as your child's future because you want to make sure they're on board for the same vision you have for your child. And the most important thing to nurturing a relationship is sometimes being a little vulnerable. And what I mean by that is we have to talk about our concerns and limitations. So lots of times we hear a doctor or a therapist prescribe lots of therapies, and we know as families that we're not going to be able to maintain the schedule that they want us to maintain. Instead of feeling discouraged about that and feeling like we're not doing what we should be for our kids, it's a great opportunity to open up conversation and actually discuss the limitation and say, with what I have to do for my child's physical therapy, I'm not able to do this for occupational therapy and this for whatever therapy every single day. How can we work together to make sure my child still gets what they need within the limitations I have for time or for whatever it is? So there are lots of different limitations we might face. They might be financial or transportation limitations. Whatever they are, we still need to make it known to the professionals who might be giving us prescriptions or giving us orders that don't really coincide with how our lives work. So it's really important to make sure that we're being vulnerable enough to talk about those concerns that we have and the things we can't do, in addition to what we want to see for our child. The next step in dealing with racism is really to ask questions. So you want to make sure you have a clear understanding of your child's diagnosis and how it affects your child. And that helps you to build expertise about your child. When we think about some of the stereotypes people might have, dealing with patients of color or families of color. Some of them deal with knowledge and involvement and engagement. And by building our expertise about our child, we can make sure that we do have the knowledge to be well engaged to overcome those types of stereotypes. It's important that we also pause for clarification. When there's a discussion that's going too fast or acronyms are being tossed around like alphabet soup, it's a great opportunity to pause, to show that you're listening, first of all, but to make sure you're clear on what's happening, what decisions are being made, and make sure your input is being added to the conversation. And just that pause to ask the questions you need to ask and inquire and dig a little bit deeper also illustrates to the professional that you are learning and that you are engaged in the process. So that's another one of those stereotypes that you can overcome by your own behavior. Finally, just make sure you're engaged in the process. Your questions show your understanding. And while it shouldn't be that we always have to prove that we're engaged and have to prove we're the opposite of the stereotype, it does help to make sure that we're clear and make sure that we're engaged and involved and attentive, because a lot of the research shows that people's implicit biases actually dissipate when they have more positive interactions with the people that they might have been biased against. So our goal here is to create a positive engagement that helps to put aside people's biases and helps them to see you as an individual and not as part of just a group. So my next step is ask for the help you need. Sometimes that's really hard to do. We shouldn't assume that resources will be offered. A lot of times families might go in and kind of lay everything out and they become vulnerable and they share what the limitations are. But we sometimes assume that once we've shared that, we will automatically be connected to resources that help us. And I don't think we realize that sometimes the doctors are not thinking about that. Sometimes the therapists are not thinking about that. So we really do need to ask directly where there's a need. And that can be an uncomfortable thing to do. Again, a little bit of vulnerability in our relationship here. But asking directly for what we need helps them to either find it for us or realize it's a thing they do need to find for us. So that also builds a bridge so that they have better understanding of your family needs and better understanding of your child. The next of the fourth of our 5 tips is address conflict. That means if something happens that makes you uncomfortable, if something happens that makes you feel stereotyped or uncomfortable in any way, make sure you put those concerns into words. Now, it's a given that the moment it happens might not be the best time to put it into words, right? Sometimes it helps for us to get a little emotional distance and give ourselves a chance to think out what happened and what didn't work for us. So if something rubs you the wrong way, definitely put your concerns into words. And if the moment isn't right then, write out your concerns, send an email afterward or script yourself so you can call afterward. Sometimes these things can be emotional, but you do want to give that professional a chance to address your concerns. Sometimes that relationship can be saved if both people have a better understanding of where the boundaries were crossed and what they can do to build the relationship. If you address your conflict and it doesn't turn out well, and the person maybe denies what you said or still doesn't seem to have an understanding that you can build your trust in, then we might have to go to tip number 5, which is to know when it's over. And that means every relationship cannot be saved. Sometimes there is a permanent damage to trust if we feel like there has been racism or bias that we've experienced. And sometimes there can be repeated things, that there are microaggressions or repeated events that look and feel like racism, and that can be permanently damaging. So, in those cases, it's really good to start thinking about how to end the relationship and look for another professional to serve your child and family. And the most important thing I think here is when you do find a new provider, talk to them about your past experience, build that relationship, but let them know what you experienced in the past so that you can let them know from the start that you want something different with them, and tell them how to build your trust. So, those are our 5 tips for dealing with racism in education and healthcare. Nurture your relationship, ask questions, ask for help directly, address conflicts, and know when it's over. Obviously, this is not going to solve every issue, but it does offer you a pathway to start to navigate around barriers and not be stopped by those barriers. I hope this has been really helpful for you. Thanks.